Direct versus indirect hernia. A hernia is defined as protrusion of whole or a part of a viscus through the wall that contains it. The commonest variety of hernia is protrusion of a viscus or a part of it through the abdominal wall. Hernia comprises covering sac and contents. Of the abdominal hernias, the common varieties are inguinal, femoral, umbilical, incisional, and epigastric, while the rare varieties are obturator, lumbar, gluteal, and spigalian. Inguinal hernia comes out through the superficial, inguinal ring. According to the site of exit, inguinal hernias can be direct or indirect. Direct hernia. It occurs through the posterior wall of the inguinal canal, through Hasselbalch's triangle, bounded medially by lateral border of rectus muscle, laterally by inferior epigastric artery, below by inguinal ligament. Sac is medial to the inferior epigastric artery. Indirect hernia. It comes out through internal ring, along with the cord. It is lateral to the inferior epigastric artery. Commonalities. An inguinal hernia is positioned above the inguinal ligament and medial to the pubic tubercle. This is used to differentiate inguinal hernia from femoral hernia. A large hernia in the scrotum will push the penis to the other side. The swelling occurs in front and sides of the spermatic cord and testis, which remain incorporated in the swelling. Expansal cough impulse occurs in swellings caused by inguinal hernia. The root of the scrotum is held between the thumb in front and other fingers behind, in an attempt to reach above the swelling. In case of inguinal hernia, one cannot get above the swelling. This can be used to differentiate from pure scrotal swellings. Differences between direct and indirect hernia. Indirect inguinal hernia comprises more than 80% cases of inguinal hernia. Direct hernia develops over time due to straining and is caused by weakness in the abdominal muscles. It is most commonly seen in adult males and rare in children. Almost all the hernias in children and women are indirect hernias. They are caused by a defect in the abdominal wall. Direct hernias occur commonly bilaterally, while indirect hernias occur unilaterally. Indirect hernias are often complete, that is, they reach the bottom of the scrotum, while direct hernias are incomplete. Indirect hernias come out through the internal ring, whereas direct hernias come out medial to the ring. An indirect hernia is piriform in shape, with a stalk at the external inguinal ring. A direct hernia is spherical in shape. Sac is a diverticulum of the peritoneum with mouth, neck, body, and fundus. The sac lies posterior to the cord in case of direct hernia, whereas it lies anterolateral to the cord in case of indirect hernia. Neck is narrow in the indirect sac, but wide in the direct sac. Hence, strangulation is rare, but can occur in indirect hernias. In many instances, direct hernia reduces itself when the patient lies down. Indirect hernia does not reduce by itself, and if reduced, does not come out at once, but requires a cough to bring it down. If the internal ring is occluded, the hernia cannot come out, even if the patient coughs. While performing the invagination test, if the finger goes directly backwards on entering the ring, it is direct hernia. If the finger moves upwards, backwards, and outwards, then it is indirect hernia. Cough impulse can be tested immediately after this maneuver. If the impulse is felt on the pulp of the finger, the hernia is a direct one, and if the impulse is felt on the tip, it is an indirect hernia. Results of the ring occlusion test. Pressure over the deep inguinal ring will occlude the indirect hernia, but not the direct hernia. Results of the Siemens technique. When impulse is felt on the index finger, the case is one of indirect hernia. When impulse is felt on the middle finger, the case is one of direct hernia. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.